Hello, my name is Sarah Webster and I'm one of the palliative care doctors at St Margaret's Hospice. This is a video about how to recognise breakthrough symptoms. This video is part of the training package in training carers or non-registered healthcare professionals in how to give subcutaneous injections of medications for breakthrough symptoms. In this video, we will cover what is a breakthrough symptom, the 5 most common breakthrough symptoms, and how to recognise breakthrough symptoms. Let's start with what is a breakthrough symptom? A symptom is the personal sensation or experience that occurs due to a disease or illness. It may be unpleasant or distressing. A breakthrough symptom. Even if someone is taking regular medications for a symptom, the symptom can unexpectedly become worse, causing distress for the person you are caring for. This is called a breakthrough symptom and may require further doses of medications to ensure that that person is comfortable. Now we'll go through some of the most common breakthrough symptoms. In the last few weeks of life, some people may experience breakthrough symptoms requiring extra doses of medication to feel comfortable. The 5 most common breakthrough symptoms are pain, breathlessness, respiratory secretions, nausea and/or vomiting, and restlessness or agitation. These are just 5 of the most common breakthrough symptoms, so if the person you are caring for experiences other symptoms, or you are unsure at any time, please contact the advice line or the district nurses. I'll now explain some ways to recognise each of these 5 breakthrough symptoms. It's important to recognise breakthrough symptoms when they happen. If allowed to get worse, they can become harder to treat successfully. The best way to recognise if someone has a breakthrough symptom is to ask them. If this isn't possible, you may need to rely on some other signs to help you. Don't worry, trust your judgment. You're likely to know the person very well, better than other healthcare professionals, and this will help you to recognise these symptoms significantly. Let's start with pain. Here are some of the non-verbal signs you may see if a patient is in pain. You may see that they are grimacing, frowning, groaning, or moving around to find a comfortable position, or resisting or groaning when you try to move them. Let's move on to breathlessness. Here are some of the non-verbal signs you may see if someone is feeling breathless. You may see fast or shallow breaths. The person might have difficulty in speaking or finishing their sentences. There may be exaggerated movements of the chest, neck or shoulders with each breath. There might be a bluish tinge around the lips or fingertips, or other signs of agitated behaviour or signs of anxiety. Respiratory secretions. As someone becomes weaker towards the end of their life, the muscles that control swallowing also become weaker. This means that saliva and airway secretions can collect at the back of the throat, causing added sounds alongside the breathing. Some signs you may hear are noisy or rattly breathing, or wet sounds with each breath. The person being cared for is unlikely to be distressed by this, but carers can find these sounds distressing due to the worry that it's uncomfortable for the person experiencing it. Nausea and/or vomiting. Be aware that nausea and vomiting can occur together or separately. You may see that the person is clammy, sweaty, or retching. You may also notice that any of these signs are made worse on movement. Let's move on to restlessness or agitation. For this symptom, you may notice some signs in the person's behaviour, including an inability to settle, frequently wanting to get up and move, a furrowed brow or frown, fidgety movements, and calling out. This symptom occurs more frequently in the last days of life and can sometimes be more distressing at night time. In summary, Recognising breakthrough symptoms when they occur is important, as if allowed to get worse, they can sometimes be harder to treat successfully. We have covered the 5 most common breakthrough symptoms, which are pain, breathlessness, respiratory secretions, nausea or vomiting, and restlessness or agitation. If a patient can't tell you about their symptoms, look for the signs described in the video. You can also find a summary of the breakthrough symptoms and their signs in the Carer Training Handbook. Thank you for listening.